Division of the DGHS, Ministry of Health and Family Welfare. I would like to welcome you all on this webinar series, which is a dream pilot project of DGHS, where through this events, we are educating our all the healthcare workers, including doctors, nurses, and all the support staffs about the various non-communicable diseases. So in the past, we have already conducted many webinars on this under this platform, where we have raised the awareness on cancers, on COPD, on diabetes, and many other issues. So today, as we are celebrating the World Obesity Day, so we are privileged to have with us Dr. Mangesh Tivaskar sir, who is who is a well-known personality and is a editor of JAPI, and so he will be deliberating on this issue. Before that, I will like, and we have Dr. Anupam Prakash, who is a director professor at Lady Hardinge Medical College, with us, and we have Dr. Saroj Kumar, who is director NHM. So before we begin with the proceedings, Dr. Saroj Kumar, NHM sir, will like to give some tips on the probable webinar on some from the Prime Minister aspect. So, sir, let me request you to please take over this dais.
अभी अभी डॉक्टर साहब स्पीकर्स को बोलने दीजिए, अभी कम लोग जुड़े हुए हैं, हमें एक मैसेज देना है कल के वेबिनार के लिए, तो मेरे ख्याल से आप लोग कंटिन्यू रखें, लास्ट में जब कुछ और लोग जुड़े होंगे तब हम एक मिनट का टाइम लेंगे सिर्फ. ठीक
है सर.
थैंक यू.
Right, sir. So let us proceed with the today's celebration of the World Obesity Day. I will request Dr. Anupam Prakash, sir, to please take this podium and introduce the speaker and our mission of NCDs from the ministry point of view. Sir.
Well, thank you, Dr. Ramesh. Thank you, the people who have been behind the series of these webinars, Mr. Avdesh, DGHS, and the whole team, which obviously is not visible all the time. But thanks to it, and hats go off to all of you for taking this endeavor in the right earnest. So I will just say a couple of points. Today being World Obesity Day, so obesity, obviously, Dr. Mangesh will be talking about it. I will introduce him to you. But the thing is that we have to understand that obesity no longer is a sign of affluence, and from the sign of affluence or symptom of affluence, now it has become a symptom of disease. So we have to understand that change. So there is a major public health challenge for all of us, and that is why DGHS has considered it most appropriate, and rightly so, to take this forum on this World Obesity Day and have a celebrated person here. So the ministry has been not only tackling the obesity but also the non-communicable diseases. With the advent of the division of non-communicable diseases because of the rising healthcare costs and the national economies that the burden they pose, the obesity and all other NCDs, now the ministry is having a segregated and a dedicated division which is taking care of it. It is important to realize obesity today serves as a risk factor for all NCDs, so many NCDs, and not only NCDs but other infectious diseases also. It does change your immune system. I'm sure Dr. Mangesh will be talking about those things. But a couple of important things which is important. The most important thing is that obesity is preventable. That is what we have to focus. That is what is the initiative of the DGHS also. And importantly, the Honorable Prime Minister, our Narendra Modi ji, sir, also Shri Narendra Modi ji has emphasized on so many activities in his Man Ka Baat also and other activities also. Every year he celebrates the International Yoga Day, which is very important, which is also a means to prevent diseases including obesity and a whole lot of non-communicable diseases. So DGHS is acting in sync with the vision of Honorable Prime Minister Shri Narendra Modi ji, and with his own schedule, the Honorable Prime Minister's schedule of increased physical activity, dietary changes that he has. The DGHS has also gone a step further in community and workplace initiatives which are there. And two strategies the government is already actually pursuing: the Eat Right campaign and the Fit India campaign, which are there. And to add to it, recently there is an initiative with the IGNU also to develop non-communicable diseases curriculum modules also. And the other aspect that the NCD division is looking into along with the yoga celebrations that the Honorable Prime Minister has said. So I will just say a couple of lines before I introduce the speaker. We have to have a multi-sectoral coordination. That is very important. That is the time now, ripe time for obesity and NCD management, for which DGHS has actually gone overboard, and that this webinar is one step in a series of webinars to take all sectors and promote healthy lifestyle and awareness in our setup. So with this, I will introduce to you Dr. Mangesh Savaskar, who is a very celebrated physician, orator, and he has been the General Secretary of the Association of Physicians of India, which is the largest physicians body. And right now, he is the editor-in-chief of the Indian Journal of Medical, the JAPI, the Journal of Association of Physicians of India, which is an index journal and world acknowledged journal. He has had a number of changes which he has inculcated in that. He has started active podcasts, even going to the extent of educational awareness seminars also. And he is a very celebrated clinician at Maharashtra. He is based in Mumbai, but yes, all over Maharashtra, he is a very celebrated physician out there. People go from far and near to show to him. And obviously, he is a national figure. And he is also going for the Obesity Diabetes International Diabetes Federation conference, which is there. So he is an international acclaimed person. That is why we thought it best to have Dr. Mangesh Sivasar with us on this occasion. So, Dr. Mangesh, over to you.
Wow, thank you very much. Good afternoon, everybody, and thank you, Dr. Anupam, Dr. Ramesh Agrawal, entire team DGHS. It is a privilege to share this platform with you. And friends, good afternoon to all of you. Those who have spared their times, as Dr. Anupam has beautifully pointed out, that Prime Minister Sir has pointed out in his Mann Ki Baat, and he has expressed the concern about obesity, the rising incidence of obesity, especially in our country. So before I really proceed in next 15-20 minutes, sir, Dr. Agrawal, sir, just let me know, is everybody comfortable with English language, or do you want me to speak, what should be the language of communication?
No, I think the language is English is preferable, but if you want to add some Hindi or something in between, so that is most welcome, sir.
Thank you very much, sir. So, namaskar sabhi ko, and we are going to talk to you about obesity. Now, today being a World Obesity Day, as far as India is concerned, what is going wrong and what is the need for talk about this? हमें याद होगा जब हम स्वतंत्र हुए थे, when we got independence, India was considered to be the poor, malnourished, जिनमें खाना पीना नहीं मिलता था. वो ऐसा देश था जब ब्रिटिशर्स ने हमारा सब कुछ लूट लिया था और गरीबी एक हमारा हिस्सा हुआ करती थी. बट देन द थिंग्स हैव रेडिकली चेंज्ड, और आपने देखा होगा कि पिछले 70 साल में धीरे धीरे, और अगर आपने ये भी देखा होगा कि इन लास्ट 3 decades ऑफ टाइम और सो, सडनली वी हैव स्टार्टेड टॉकिंग अबाउट मोर एंड मोर अबाउट द ओवरवेट एंड द ओबेसिटी. जो स्थूलता और मोटापा, ये दोनों के बारे में हमने बात करना शुरुआत कर दिया. So a big fat thank you to the team, and I don't have any specific disclosures for this talk. And next 15 minutes of time or so, I'll talk to you about कि ये क्यों important है हमें जानना, why it is necessary for us to know about obesity, what are the health impacts. Dr. Anupam has beautifully pointed out a couple of important aspects of it. How do you treat it? And I'm not going into the details about the medical management of obesity, but what we can do as at the grassroots level and at the society levels. And majority of my data is again the work which is published by again the DGHS of the Ministry of Health and Family Welfare, and this was published in 2021 in Elsevier Journal of Diabetes and Metabolic Research. Now मित्रों, हम ये देख रहे हैं there is a distinct epidemiological drift or shift. So जहां भारत में मृत्यु का कारण कई बार इन्फेक्शियस डिसीजेस हुआ करता था, वो अभी बदल के we have shifted ourselves to chronic degenerative, I would say man-made primary cause of mortality and morbidity. This picture has changed the way I look at obesity. This was a picture which was taken by Kevin Carter of Sudan famine. And this shows a dying child, and vulture is waiting to eat it, and the vulture is waiting for the child to die, and girl child she was. And this got published in New York Times 26th March 1993, 3 decades back. This picture won Pulitzer Award. But do you know that Kevin Carter ultimately, after 3 months, committed suicide because he could not save the child, because photographers were instructed that they are not supposed to touch the children. Why I'm showing you this is because our world has changed now. Now the world has changed to this. Now why that has come? It is because of the obesity siege. And that reminds me of this National Geographic picture, which got published in 2003, where a 20-feet shark is approaching 4-feet kayak. We are in the middle of nowhere. So friends, lay media, everybody in the world have started talking about the challenge that has suddenly cropped up. Even though it may not be sudden, but then we have started realizing it as a challenge suddenly. And we have started talking about what we call it as obesity, motapa, which is a heterogeneous का मतलब होता है कि different causes are there, कई कारणों से होता है, complex disorders of multiple etiologies, and which is characterized by, क्या होती है इसकी खासियत, चर्बी का अति होना, so excessive deposition of the body fat, and which affects the physical, the mental, social, and economical health, not only of the family or the person, but as a whole, as a nation, as a country, it is affected. Long back in Charak Samhita, there is a mention of obesity, and he describes 8 different body phenotypes which has got 8 defects: shortened lifespan, hampered movements, difficult in sexual activity, debility, foul smell, over or excessive sweating, too much of hunger, and excessive thirst were the 8 defects described by Charaka. I'm sad to say that, as Dr. Anupam rightly said, that 2/3 of our current population is related, and the illnesses are related to malhealth. And malhealth is not undernutrition. And why I say so? Because if you can see, कृषि क्रांति से पहले, in the pre-agricultural era, we always were in a phase of what we call it as hunters and gatherers. So शिकार करके खाते थे हम लोग. जब ये मनुष्य की उत्क्रांति हो रही थी, तो we were hunters and gatherers. And look at the status and the stature. Thin, lean, robust, muscular लोग हुआ करते थे. फिर बाद में पहली कृषि क्रांति आई, उसके बाद में second agricultural revolution came. But now the challenge is the industrialization, the abundance of food, and जिसकी वजह से मोटापे का चैलेंज आने लगा है. And that is the reason why this cartoon makes a sense to me, that if you really look at the evolution of the mankind, पिछले 25 लाख सालों में अगर हम होमो इरेक्टस और होमो सेपियन बने हुए हैं, इफ एट ऑल वी आर, बट पिछले 50 साल की हमारी जिंदगी में, बिकॉज ऑफ आवर दिस स्टाइल दैट इज देयर ऑन योर स्क्रीन, वी हैव बिकम होमो डायबिटिकस एंड होमो ओबेशियस. कितनी शर्म की बात है. This is what I call it as McDonaldization of our society, Pepsification of our society, or waste toxification of our society. पाश्चिमात्य आहार पद्धति और जीवन शैली के अपनाने की वजह से ये हमारे पास ये चैलेंजेस हुई है. वी आर सराउंडेड बाय द सुनामी ऑफ फूड्स एंड जंक फूड्स एंड फास्ट फूड्स, एंड दैट मेक्स अस नॉट malnourished, but that makes us all overnourished. Think about it. Look at the changing portion sizes and the portion sizes which has changed over last 2 or 3 decades. याद करो, आप 30 साल पहले आप अपने माता पिता के साथ में किसी नाटक में या किसी ड्रामा में या किसी थिएटर में या कोई फिल्म देखने के लिए थिएटर में गए होंगे, तो जो पॉपकॉर्न का डब्बा मिलता था वो इतना हुआ करता था. आजकल के बच्चे जब थिएटर में जाते हैं तो पॉपकॉर्न का डब्बा इतना होता है. कोई भी फास्ट फूड जॉइंट में आप जाइए और आपको पता चलेगा कि वहां लिखा हुआ होता है कि 5 रुपए एक्स्ट्रा दीजिएगा एंड वील गिव यू 50% ऑफ मोर कोक एंड 50% ऑफ मोर फ्राइज, और हमें लगता है कि हम पैसा बचा रहे हैं। सीरियसली, हम पैसा बचा रहे हैं? थिंक अबाउट इट, बिकॉज टुडे food has become the weapon of mass destruction. You don't require wars to destroy societies and nation. Food has done the job adequately. Why I'm so critical about Western diet? Because it is a diet which is reduced as far as the nutrient density is concerned. It has excessive energy which we do not require. High in saturated fat, very high in the refined sugar. Classic high fructose corn syrup क्या है? High refined sugar, low in fibers and very high in salt. So obesity is now globesity. It is a global challenge. It is a global pandemic which has led to what we call it as an epidemiological shift. So it's a disease which is recognized by most of the global association as not just the situation or a clinical condition, but it is a disease which needs treatment, which needs alteration. अगर बात करूं इसके एक्सटेंट की, इसका क्या असर हुआ है हमारे जिंदगियों पे, तो ये सोचिएगा सबसे डेंजरस चीज में जो आपको बताने वाला हूं कि ये जो फिगर्स, ये ओबेसिटी, वर्ल्ड ओबेसिटी डे के वेब पेज पे लिखा हुआ है। 1.9 billion people are likely to be obese by the end of 2035. So एक दशक के बाद में ये परिस्थिति आने वाली है। Look at the amount of the money that we are going to spend on management of the obesity related diseases. $4.3 trillion. 100%, 100% increase in the possibility of obesity. Every 1 in 4 people are obese, and मैं हमारा एशियन स्टैंडर्ड यहाँ अप्लाई कर नहीं रहा हूँ। आई एम नॉट अप्लाइंग इवन एशियन क्लासिफिकेशन ऑफ ओबेसिटी। एंड अगर मैं कहूँ कि 15 साल पहले अगर इंडिया में 13% स्थूलता का या ओबेसिटी का चैलेंज था, तो अभी जो रिसेंट डेटा लैंसेट में पब्लिश हुआ है, वो भी मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर से है। आप भारतवर्ष का नक्शा देखिएगा, वॉच द मैप, and you can clearly see the incidence and the prevalence of the obesity is anywhere in the range of 50% or above. This is Dr. Anjana Mohan's paper, which is called as an ICMR INDIAP study. This was an ICMR INDIAP 3 data, which was got published in 2015. But see the figures. The generalized, the abdominal, and the combined obesity is in the tune of 56%. 56% का मतलब जानते हो क्या होता है? हर दूसरा इंसान मोटापे से त्रस्त है, स्थूलता से त्रस्त है। अंडरस्टैंड दैट। एब्डोमिनल ओबेसिटी, कंबाइंड ओबेसिटी, everything has made our nation maybe probably walking on the path of global capital of obesity. So India is likely to become Globendiana. क्यों हमें इसके बारे में ध्यान रखना जरूरी है? बिकॉज ये समझिए कि ओबेसिटी विल किल यू फास्टर। तकरीबन दशक या 15 साल आपकी जिंदगी के कम हो जाते हैं। सो कभी आपको ये प्रश्न पड़ा है, हैव यू एवर आस्क्ड योरसेल्फ व्हाई वी, क्यों हमें ही क्यों ज्यादा डायबिटीज होता है? हमें ही क्यों ब्लड प्रेशर की बीमारी का सामना करना पड़ता है? सबसे ज्यादा अधिक दिल की बीमारियां, हार्ट अटैक्स, स्ट्रोक्स, पैरालिसिस, किडनी फेलियर्स हमारे देश में क्यों होते हैं, भारतवर्ष में क्यों? क्योंकि 155 million children, childhood obesity is the biggest challenge currently India has. Look at the report which got published in 2017. Now 6 साल पहले वाली ये रिपोर्ट है और 8 साल पहले वाली रिपोर्ट है। इंडिया हैज हाईएस्ट नंबर ऑफ ओबीस चिल्ड्रन इन द वर्ल्ड। अगर हम ये सब चीजों से दोस्ती करेंगे तो शायद हमारा हाल यही होने वाला है। और ये किया किसने? वी आर कल्प्रिट्स। हम गुनेगार हैं इसके बारे में। हमने अपने बच्चों को इससे अवगत कराया है। वी हैव हैंडेड ओवर द जंक फूड टू आवर किड्स। आई टेल यू माई ओन डेटा। हमने यहाँ मुंबई में 7 बिग प्राइवेट स्कूल्स का सर्वे किया है, व्हाट वी कॉल्ड एज अ स्कूल बॉक्स टिफिन सर्वे। अभी पब्लिश होने वाला है वो जापी में। और हमने उन स्कूल्स को ही चूज किया जिसमें 1,000 से ज्यादा स्टूडेंट्स है, from junior KG to 10th class, and we screened 11,126 tiffin boxes. कैन यू बिलीव दिस? ओनली 12%, मतलब ये 11,000 डब्बों में से सिर्फ 1,300 टिफिन्स हैड हेल्दी होम सेंट डाइट, होम मेड डाइट। 17% स्टूडेंट्स वांटेड टू ईट इन स्कूल कैंटीन्स, और आप स्कूल कैंटीन्स के बारे में जानते हो, यू नो अबाउट स्कूल कैंटीन्स। And 71% whooping tiffins had white breads, chips, chocolates, biscuits, jams, fries, pastries, cakes, cream rolls, dry fruits. On the top of it, we have removed the exercise, physical activity classes, hour of classes from the school curriculum in the quest to study. इसीलिए ये ओबेसिटी का प्रिवेलेंस बढ़ा है। This is the global obesity observatory data that I am showing you. What is most concerning is inadequate physical activity. भारतवर्ष में 34 से 50% लोग और बच्चे, they are physically inactive, as Dr. Anupam was talking about. Even our honorable Prime Minister mentioned in his Man Ki Baat about this. Very few consumption of fruits. Not only that, the trends of obesity in children are grossly increasing. We need to have better regulating market. So FSI has to come into the picture. We have wonderful policies as far as the product labelings are concerned, but we need to have a clear fiscal policies as far as the health products are concerned. They are mandatory policies which will restrict children to have access to this junk, energy dense junk food. We need to have that education implemented in the school days. सो अगर आप एशियन इंडियन फिनोटाइप्स के बारे में बात करें, तो वैसे भी हम भारतीय, वी आर ऑल इंडियंस विच आर हु आर लेबल्ड एज थिन फैट इंडियंस। हमारे पास बुद्धि तो बहुत अधिक है, वी हैव गॉट वंडरफुल ब्रेन्स, वी गेट चेस चैंपियंस ऑफ द वर्ल्ड, but we will never win marathons. We will never win the 100-meter dashes. Why? Because our muscle mass is much lower. In comparison, our fat mass is extremely high. This was a beautiful YY paradox. Two gentlemen on your screen are Professor Dr. Chittaranjan Yagnik from BJMC Pune and Professor John Yudkin from Oxford, London. सभी दोनों का, both their height, weight, they were all same. Their BMI same, but look at the body mass fat content. अगर आप डॉक्टर याग्निक से मिलोगे तो you'll realize कि डॉक्टर अनुपम से मिल रहे हो आप, उसी तरह की पर्सनैलिटी है उनकी, but look at the amount of the body fat percentage, 3 times higher than the globe. और उसी वजह से ये सब चैलेंजेस जो हमारे सामने स्क्रीन पे है, ये लोगों में आ जाते हैं। कैसे मेजर करते हैं हम ओबेसिटी को? ग्रॉसली जब patients once they go to the doctor, they'll generally find out somebody is overweight or obese by measuring the BMI, the waist hip ratio, and the waist circumference. BMI काफी हद तक इनकरेक्ट मेजर है, आप एग्जांपल सामने देख सकते हो, बट नाउ there are other methods that we use in our clinical practice, right from BMI to waist hip ratio. आजकल DEXA स्कैन होता है, we have got bioelectrical impedance measurement, waist height ratio भी मेजर किया जाता है, we also measure that, and we also do sometimes MRIs or CT scans to diagnose. But friends, you have to understand that there is a different class which is applicable as far as the classification of the obesity is concerned in the Indian population. जब भी whenever you see any patient of obesity, always look into this point. Always ask for the genetic history. Always ask for the family history. Always ask for the exercise history, the comorbid conditions, the detailed history and the examination and the investigations like check for diabetes, check for cholesterol, check for liver function tests, vitamin D, बहुत जरूरी है. Find out about his cardiac condition, ECG, 2D echo, stress test, and also have some method to assess the fat content of the body so that you can effectively bestow your advices on these patients. कई बार, so many times we encounter patients, those who are taking medications for different reasons, like few antihypertensive drugs, few anti-diabetic drugs, hormone replacement therapies, highly active antiretroviral therapies, HIV AIDS के लिए जो treatment दी जाती है, antidepressants can cause weight gain. So keep a watch. आखिरी 5 minutes, I'll talk about what needs to be done now. Always remember that diet and lifestyle change is a key benefit. And always make your patients aware that initially there will be a good or sometimes great response to this intervention. But then as this continues ahead, the response becomes slower, longer. So what should be your treatment goal? The first is to prevent the further weight gain. Second is try to give the realistic, holistic targets. कोई भी मरीज, whenever you see any patient who is obese, never give him or her the unrealistic targets. Like next 3 months में हमको 15 किलो वजन कम करना है. Not possible. Give them the realistic targets, understand their challenges, focus on the long-term maintenance of the therapy. Treatment needs to be on the both aspects. I will not go into the details about it. That is generally done by the specialist or the clinician. But the most important backbone of your treatment is nutritional advices, physical activity, behavioral therapy, and then comes the drug treatment or sometimes surgeries. So अगर आप pyramid के बारे में बात करें, so आप देखोगे the base is by the lifestyle modifications. Then comes the pharmacotherapy, and the top of the pyramid is formed by the surgery. कई डाइट्स हैं हमारे पास. मेडिटेरियन डाइट, डैश डाइट, कीटोजेनिक डाइट के बारे में आपने सुना होगा, ऑर्निश डाइट, पैलियो डाइट. महाराष्ट्र में बीच में एक कोई डॉक्टर के नाम से डाइट फेमस हो गया था, आई नॉट नेम हिम. vegan diets, different type of vegan people are there. But understand that rather than going to the quacks for the dietary advices, go to the experts, because these dietary advices have created the most confusion in the minds of the patients and even the healthcare professionals. Partial meal replacement, which is generally advocated by all of us, including Dr. Anupam and Dr. Agrawal, are the diets which actually have shown the wonderful effect as far as managing obesity is concerned. So use them very smartly. Partial meal replacement means that you are replacing one meal at least by some kind of a low calorie, high protein intake with high fiber intake. But the most important part is increase physical activity. Understand, for Indian population, start at least 30 minutes 3 times in a week, but then in next 2 to 4 weeks of time, you must reach to 60 minutes every day or at least 5 times in a week. Understand, if you combine it with the diet control, this is one of the most effective managements for the weight. अगर ये fail होता है, तो then you have got the drug therapies. And there are so many drugs have come and they have gone. Unfortunately, we do not have effective drug therapies to manage obesity currently. Even though now on the horizon, there are phenomenal drugs which can cause or give you almost 50% drug, dose, 50% weight reduction for the target. It is as good as, as good as you are advising somebody to go for a bariatric surgery. But if I would tell you about what are the current drugs which are available, orlistat, liraglutide, semaglutide, and tirzepatide. We just this month only, or पिछले महीने में, Association of Physicians of India have brought out very smart use of liraglutide as far as the Indian subclass of the obese patients are concerned. But सबसे दुख की बात है, so much painful to talk about this, that most of the anti-obesity drugs are unfortunately not tolerated very well. They do have what good amount of side effects, and they are very expensive. So beyond the reach of common man. So pharmacotherapies in India still are extremely distant. Now, why I'm making you to realize it? That because unless and until you get sensitized about prevention of weight gain, you will not be able to stop the menace of the non-communicable diseases. Bariatric surgery, wonderful tool, one of the best ways to reduce weight by almost 38 to 50%. There are huge benefits, but हम में से कितने लोग उसको अफोर्ड कर सकते हैं? What about and these are generally advocated to people whose BMI is above 35 or above 30 with some kind of a comorbidities. But what about those people, those who are in between the BMI of 25 and 30? Those who have challenges of non-communicable diseases but cannot undergo the bariatric surgeries. There are many procedures which are available. There are new drugs which are coming up, and there are galore of drugs. I'm going to show you just brief glimpse of this. These are all the drugs that we are going to get. इसके बारे में काफी संशोधन चल रहा है, and the horizon is beautiful. But probably our generation may not be happy to use these drugs. Our upcoming generations are going to face this. They are going to have gene mutation targets. There will be treatments which will increase the muscle mass. Currently, we do not have any treatment which can cause increase in the muscle mass. Visceral fat browning therapies are going to come. There is a good data on the fecal microbiota transplant. But friends, currently, the only way to manage effectively obesity is to build the dam to the tsunami of all that junk food which is available. Food we eat just because it is available. Every time you should think about it genuinely. Am I supposed to eat this food? Do I really need it? Remember your last time when you have attended a big fat wedding and you visited every different stall in the reception party. Junk food is flooded there. Are wah, there's a French food. Are wah, there is a Maharashtrian food. Punjabi. There is a Mexican. Are there is some very delicious local South Indian cuisine that is. And I have not even talked about the sweets and the dessert section at all. Don't you do that? Have you ever thought that genuinely is my body really needs it? So think always before you visit the grocery stores, the corner stores, the movie theaters, the fast food restaurants, school sports events, and even at the schools. Use smartly. Learn how to eat smartly. And as Dr. Anupam has said, the action is needed at every possible level, but the action must start from yourself. Do not put the responsibility on somebody else's shoulder to manage the menace of obesity that we are already in and our future generations are going to face it. We as doctors, as clinicians, we keep on saying diabetes, pressure, obesity related challenges walking when a 7-year-old obese boy walks into my chamber. So we do need actions at every possible level. I think to do that, we need another satyagraha of reducing down. It is important to stop now to people from eating what they do not need to eat. I am waiting for the magic. I believe you all guys would be also hoping to do so. So I'll end my talk by saying that, friends, it's the health which is a boon of the nature. For the best ever creation of the nature, by the most important thing that you can do is please do not waste your earns on the Western diet and let the West earn out of it. Thank you very much and have a great day. I hope I have probably tried to touch the important aspects of obesity management. I would be happy to answer any questions if I have not confused you people adequately. Thank you very much.
Well, thank you, Dr. Mangesh, for a splendid session, I would say. And in fact, I can already see in the chat box that many people are asking for PDFs and PPT copy of your presentation.
I would
So I
surely
have
share.
some queries are there.
Yeah.
Thank you, Dr. Mind Action also. Dr. Ramesh, if you permit, there are some queries.
Sir,
Yes.
if you can request Dr. Saroj if you want to intervene and tell about the something what you wish to. Dr. Saroj, if you are there, sir, if you want to
Dr.
speak
Saroj
at
is here.
right now.
Yes, I am here.
Yes, sir.
I want to make one request to the listeners, all the listeners, that tomorrow we have one webinar session at 2:40 to 4 p.m. regarding a daycare cancer center. Prime Minister sir will speak in forenoon, and in afternoon, Honorable HFM and Secretary Health will address 15 experts we arranged to give their thoughts regarding the establishment of डे केयर सेंटर. हम लोग डे केयर सेंटर कैंसर के लिए बनाने वाले हैं हर डिस्ट्रिक्ट हॉस्पिटल पे. तो कुछ 14-15 हमारे एक्सपर्ट्स रहेंगे और हमारा रिक्वेस्ट रहेगा सभी लोगों से कि मैक्सिमम लोग जितने भी कंट्री में जुड़ पाएँ उससे जुड़ें, जिससे अवेयरनेस आएगी और आगे हम लोग क्या करने वाले हैं उसकी जानकारी मिलेगी. थैंक यू.
Thank you, Dr. Saroj. I think it is a very important endeavor of daycare centers for cancer chemotherapy. So that will be a wonderful thing and everybody should attend. Coming back to Dr. Mangesh's enlightening and educative lecture. So there are a couple of questions in the chat box to Dr. Mangesh. Some are obviously related to, we have the World International Women's Day on the 8th
Yes,
now. So
yes,
there are specific questions for post-pregnancy weight loss. It is very difficult to achieve.
yes.
And likewise, perimenopausal weight gain.
I'll again come to that, and I'll give you the example of my own wife. Okay, you must
So,
understand that why girls after pregnancy they suddenly gain weight. In India, especially, why we get that? It's primarily because the moment the child is born, or sometimes the girl becomes pregnant, the family people load her with the calorie dense घी में डली हुई चपाती खिलाते हैं भाई. I don't know how many of ghee studded laddus are served on her platter. पूरे दुनिया में ऐसा कहीं नहीं होता है. It doesn't happen anywhere in the world. The mother, the would-be mother, and the freshly become the mother who is fresh, she's been freshly bestowed the motherhood. She is bombarded with nutrition dense food without much of the physical activity, so they gain weight immensely. And the moment you get the central obesity, the moment you develop that paunch, there are no exercises except some of the yogas that can actually take away that fat which you get in your paunch. So that is the primary reason that always encourage mothers immediately after delivery or even during delivery to see to it that they eat sensibly, and also they follow the exercise patterns as per the advice by the gynecologist and obstetrician.
well, very nicely addressed. So eat right is the message that is important always. Perimenopausal weight gain.
Yes, so generally perimenopausal weight gain again comes back to the hormonal adjustments, certainly. That comes to that. But again, I will not blame it just purely on the hormones. Okay. It also generally is primarily because of the psychological changes the women undergo. They tend to have those mood swings. They become depressed. They don't want to move around. They don't want to go out sometimes. So there are not only the hormone related bodily challenges, but also there are some mental psychosocial challenges which a woman goes through that actually causes a higher amount of weight gain. And also it is imperative for them to keep on being active and mobile, get involved in the physical activities, go to the social clubs, do your gymming. Most of the societies, especially in the tier 1, tier 2 cities, will have some kind of gyms and physical exercises, or at least walk. Walking is the most beautiful exercise I can recommend to every one of us. Simple, cheap, freely available, doesn't require any cost, can be done at any time of the day. Stop thinking about कि सुबह उठ के चलने का है. No, any time which is comfortable and suitable for you, you can walk. And there was a beautiful editorial of one of the mobiles, walk when you even talk on the mobile phones.
Very important and pertinent advice. Another question, Dr. Mangesh, is about most of the young adults who are gymming. They are given whey proteins and non-vegetarian proteins as sources without any fiber, fruit.
Correct.
So any comments on that?
Yes. So always there is no harm in taking these kind of proteins, especially, but has to be by an expert advice. Please do not listen to the people, those who are selling those products in the medical stores, on the social media platforms. Not all products are suitable for each and every person. Every person's needs are different. Every person's medical challenges are different. Every person's particular tolerances are different. So you can have those tailor-made things, have expert advices on that, eat right with the expert advice, and continue monitoring yourself rather than following the advices blindly, especially on the social media platforms.
Another question is about the fat loss supplements and nutritional supplements which are there.
Yes.
So
So there
what
are
is
few.
your take on it?
Yeah, so there are few fat loss supplements which are practiced. I will not say they are bad. They are okay. They are supporting therapies which are there. In fact, in our medicine or in the medical management also, if you see the, one of the drugs which is there is orlistat. And now these GLP-1 receptor agonists which have come, SGLT2 inhibitors for diabetes management have come. These are the drugs which can be easily advocated. Dedicated fat loss therapies were there, but they had significant side effects. And that was the reason why, if you remember recently, a couple of drugs were banned from the use because they did have very serious side effects. There are some side effects because of the anti-obesity drugs, which caused a very dangerous situation, which is called as cardiomyopathies. So be very watchful when you are, choosing this kind of therapies. But my hand-folded request to everybody: please keep yourself away from the advertised products. Please keep yourself away taking themselves or any kind of nutritional or therapeutic interventions for managing weight without consulting your specialist or doctor. Ask about it. Check whether it is comfortable and suitable for you. Then only go for it.
Well, thank you. Thank you so much. I think that is what people have given a positive feedback. Great session, very useful. Thanks a lot, Dr. Mangesh Srivastava, sir.
All credits
So
to you,
many
Dr.
are there. I am
Anupam
not
and
saying, I'm
Dr.
just reading out
Agrawal.
one of the comments which just appeared.
Yeah.
So I will hand over the mic with thanks to Dr. Mangesh. I will hand over the mic back to Dr. Ramesh Agarwal to the NCD division, DGHS.
Thank
If at all I have
you.
to share this PPT, where should I send it so that you can send it to all the participants?
Yes, so we will be sharing you the email ID, sir, where you will
Yes.
be sharing this PPT for the benefit of the
Oh
audience.
yeah, sure.
और संक्षेप में सर आपने इतने सुंदर तरीके से और सखत तरीके से बताया कि अब खाना ही जो है हमारी एक समस्या बन चुकी
बड़ी
है।
समस्या
कितना
बनी।
खाना है और कितना खाना है और क्या खाना है, इस पे ज्यादा ध्यान देना है। हर जगह हम खाना ना ढूंढें,
Yes.
चलने पे भी ध्यान दें। और यही शायद हमारे लिए आज का मैसेज है। हमारी तरफ से सर बहुत बहुत शुभकामनाएं आपको। आपने बहुत अच्छे से और बहुत ही तरीके से जो कि हमारे लिसनर्स हैं उनको आपने प्रेरित किया। वी आर वेरी थैंकफुल फ्रॉम द मिनिस्ट्री डिवीजन सर, फ्रॉम द एनसीडी डिवीजन। So
Thank
I
you very
once again thank Dr. Mangesh, Dr. Anupam sir, Dr. Saroj, and the entire ECO team and all the participants and the team who is working behind this NCD webinars. So thank you very much. Thank you, sir.
Dr. Agrawal, Dr. Anupam, especially, I must also compliment a great work which has been done by DGHS and the entire team of Ministry of Health and Family Welfare, which are working on the non-communicable disease. I almost get fascinated every time when I visit your website, whenever I get the new information about all these things, which I generally use in my most of the presentations. So my compliments, by big thanks to all of you. And of course, Dr. Anupam, thank you very much. And Dr.
Thank you.
Avdesh ji, thank you very much for the wonderful opportunity. That was a great
Thank you so
platform.
much, sir.
Thank you very much.
Thank you, sir.
Thank you.
Thank you. Thank you
So
very much.
coming to the PPT, once I will receive the PPT from
Please
Dr.
send me
Ramesh, sir.
share the link on my email, please. I'll send
Sure,
them,
sir. I'll connect
I'll
with
send
you
it
for the
immediately
PPT.
so
So
that
I just wanted to inform all the participants, but on our IECO platform, I will upload it. You can download the PPT from there. Everyone, no need to receive any particular email. You can download it. Thank you, sir. So Ramesh, sir, we can wind up the session with your permission.
Yes, yes, please, please.
Permitted
Thank
to
you,
leave?
sir.
Thank you.
Yes, sir. Thank you,
Thank you very
Mangesh, sir.
much.
Thank you,
Bye-bye.
Anupam,
Stay
sir.
safe, stay happy.
Thank you, sir.
Thank you.